I'm Jan Proctor-King and I'm a primary care cardiovascular nurse. A cardiovascular risk assessment is where we collect lots of information about you, usually for people who are aged 40 to 74. And we collect information including their age, their sex, their ethnicity, their family history of cardiovascular disease, so that's their mother, father, brothers and sisters, if they've had cardiovascular disease before the age of about 60. 55 and under for men and 65 and under for female relatives. And a cardiovascular disease would include a heart attack, a stroke, a mini stroke, angina. Evidence that the blood vessels to the heart or around the body have been narrowed with atheroma. And we also look at their blood pressure, an individual's blood pressure. We look at the level of cholesterol in their blood. We look at whether they have borderline raised blood sugar or frank diabetes. We look at their levels of physical activity. We look at whether they smoke, very importantly. We collect all this information together to estimate how likely it is that they are at high risk of cardiovascular disease. What happens when you have a cardiovascular risk assessment is really quite simple. I think people expect it to be much more complicated. You would initially visit to have some blood taken, because to know the level of cholesterol in your blood, we need to take some blood. We can also look at the level of sugar in your blood, should that be necessary. You take your blood pressure, take your weight, take your height. When you've got the results back from the lab from your blood test and all the other information, you can then attend, and usually you visit a nurse, a practice nurse or a healthcare professional. And with all this information together, you're then able to discuss with the nurse, what is your risk? How's your lifestyle affecting your chances of developing cardiovascular disease? This gives you the opportunity to decide about your lifestyle and decisions that you make. You may want to lose weight and become more physically active to prevent diabetes. You may want to drink less. You may want to alter the level of salt in your diet. We look at cholesterol and we measure it when you have a cardiovascular risk assessment, and we look at the ratio of bad cholesterol, the LDL, and good cholesterol, HDL, because not all cholesterol is bad for you. HDL, termed high density lipoprotein, clears up cholesterol, takes it out of the system, is helpful. LDL is the one that delivers cholesterol to our cells that we need, but can also line the blood vessels. So we want some, but not too much. We can reduce LDL and we can reduce cholesterol levels with drugs. And in some cases, at a cardiovascular risk assessment, it will be shown that you're at a level high enough to warrant offering you a drug to lower the LDL and the cholesterol in your blood. And it's an option that people can take. But a cardiovascular risk assessment lays out your options from which you can choose all or none. Some of those options are medication. Many of them are lifestyle, but it's not always clear what will be helpful to us. And the idea of a vascular risk assessment is that we lay it out clearly, share information so people can make informed decisions about how they want to live the rest of their lives.
For more information, visit www.nhs.uk.